Post-traumatic stress disorder, or PTSD, is a disorder where someone is exposed to a trauma, experiences a trauma that is either something where there is threat of physical harm, there is threat of possible death, or sexual assault. So this can be either someone who experiences one of these incidences or witnesses someone else experiencing it. So it can be really a wide variety of traumas that could be included in this. It can be, fires, abuse, sexual assault, witnessing a crime, witnessing something violent, and basically the person has difficulty processing the trauma and ends up with symptoms of dissociation, avoidance, withdrawal, flashbacks, which is basically when you re-experience the traumatic event and it almost feels like it's in real time. And it can cause a lot of depression, anxiety, oftentimes substance abuse as well. Sometimes they will really avoid things that remind them in any way of that traumatic event. So they may stop going to school, stop going to work for fear that they'll experience something that will feel like the trauma. They'll also have a pretty deep experience of guilt. They may feel in some way responsible for the event, and they may also feel resulting shame for that feeling of responsibility for the traumatic event. So there are actually several really good evidence-based treatments for PTSD. Some of the most evidence-based treatments that we have are trauma-focused cognitive behavioral therapy, which is really effective for younger children and adolescents, cognitive processing therapy, and prolonged exposure. CPT, or cognitive processing therapy, and prolonged exposure, or PE, are the two gold standard treatments that are used at VA hospitals across the country. Another evidence-based treatment that has some preliminary support is EMDR, or eye movement desensitization reprocessing, which is another exposure-based treatment that really taps into exposing someone to the trauma and kind of reprocessing it in a more healthy way.